Prepare to have your health questions answered here on Safe, Effective Natural Solutions with Dr. Todd Binkley, owner of Binkley Healing Center in downtown Ventura. Now, here's Dr. Todd.
Good afternoon. I'm Dr. Todd Binkley, board-certified non-forced doctor of chiropractic and practitioner of functional medicine. Functional medicine means using standard diagnostic tests to identify conditions that other doctors miss. The last couple of episodes, we were talking a lot about the microbiome, and then this is something that actually affects today's topic, but the focus is going to be, and it's kind of complex, but a lot of people are concerned about dementia, cognitive decline, cognitive impairment, Alzheimer's disease, etc. And so the title for today's talk is Dementia, Diabetes, and Cardiovascular Disease, Inextricably Linked. You can't have one without the other. They go together. And the sad thing is most people wait until they have severe signs of cognitive decline, memory loss, dementia, before they consider doing anything about it. So how do you know if you really need, ideally everyone should start doing something about it in their 30s. And that's just probably never going to happen. You definitely don't want to wait till your 70s or your 80s, especially if you already have a familial history of risk for, if one of your parents had severe dementia, then there's a hint to start earlier, identifying risk factors, things that can be mitigated in advance. Here's something that anyone can do. The APOE gene test, apolipoprotein E gene test. There's 3 different versions that are the result from the test, 2, 3, or 4, and we have a pair of each. So the results are going to say that you have, APOE 2 and 2, 3 and 3, 4 and 4, 2 and 4, 2 and 3, 3 and 4, etc. You get you have 2, and each of them is either going to be 2, 3, or 4. Sounds a little tricky, but the takeaway is folks who have APOE 2 4s, 2 examples of the APOE 4 gene test, are at the highest risk of dementia. So it's really important to know if you're one of those people, because your risk is dramatically increased, and it would behoove you, hopefully motivate you, to do some things earlier to reduce your risk. So that test used to cost $700 or $800. I just checked today. It's down to $340 now through LabCorp, which is still pretty expensive for one gene test. Some people are a little reluctant to do 23andMe gene testing for a host of reasons, but I figure, you've got to worry about how they're going to protect your data, but they've done a pretty good job of it so far, and I think if they ever abuse it, that someone could run and win a Senate campaign to crack down on any transgressions they might have made. So that's a little bit of diversion. 23andMe, what's great about this health test, not the hereditary, where do your ancestors come from, but 23andMe offers for $149 a whole slate of gene tests that individually cost hundreds of dollars each. So it's thousands of dollars worth of gene tests that are really useful, including the Alzheimer's gene, blood clotting factors, hemochromatosis, iron overload, a whole host of other genes. You can look them up on their website, and it's just a huge bargain for $149. And when I test people, when I do people's blood tests, or when they come in with certain conditions, I often ask them, have you done the 23andMe gene test? Because that can provide some information that we can use. Is this a genetic condition for you, or just the result of your diet or your lifestyle? So that's really helpful. And one of the reasons that's helpful is outlined in a study that just came out last week and published in the Journal of the American Medical Association, showing the benefits of taking fish oil supplements to reduce your risk of brain damage that causes cognitive decline. So this was just published August 1st in JAMA, Journal of the American Medical Association. Older adults with lower intake and tissue levels of these 2 main omega-3 fatty acids, EPA and DHA, that you can only get from fish oil, the people they tested that had, that they gave a certain amount of this, and I'll get back to that, had more, who didn't have adequate levels of this, had more brain white matter lesions, which is associated with small vessel ischemic disease, basically loss of blood flow to the tissue of the brain so that it can heal and repair itself. And that is a major contributor to the development of dementia, including Alzheimer's disease. And this study showed may be preventable through treatment with omega-3 fatty acids from fish oil. So the people who tested with two APOE4 genes, carriers of that gene pattern, had significant reductions in neuronal integrity breakdown over 3 years by supplementing with fish oil. And these were participants with an average age of 81 years old that already had white matter lesions on their MRI, the early signs that you can see on a scan of the damage to the brain that causes dementia. And it was a pretty modest intake of fish oil that this study used, 1.65 grams, a little more than a gram and a half, a little more than 1,650 milligrams specifically of combined EPA and DHA, the two important omega-3 fatty acids that you can only get from fish oil. You can't get any significant amount of EPA or DHA from any vegetable source, from chia seeds or flaxseed oil or any of these other vegetable-based oils. You can get it from algae, but it's very expensive, 2.5 times the cost of getting it from fish oil. So the easiest way to get EPA and DHA, these brain-protective omega-3 fatty acids, is from eating fish, oily fish like sardines, anchovies, salmon, and tuna. But the problems with salmon and tuna, eating too much tuna, unless you're getting small pole-caught, smaller fish that are tested to be lower in mercury, which you can get in a can. The brands that you can get in cans in stores, Vaughn's or standard stores, Wild Planet and Safe Catch, you can get tuna, which is a great source of omega-3s and has lower mercury than eating tuna in a restaurant or getting the chicken of the sea canned tuna or basically any other kind of tuna. Even, fresh caught fish, if it's a big fish, it's going to be high in mercury. And so salmon also has a lot of omega-3s in it, but unfortunately most of the salmon that we eat is farm raised, and that has a host of other problems as well. So if you get fresh caught salmon, which you can often get frozen in stores, or some restaurants serve wild-caught salmon, that's also an excellent source. It's always great to get everything you can from food, but it's very difficult. It's so difficult for most people to get enough omega-3 fatty acids from ocean-based foods that I recommend almost everyone supplement fish oil to get the omega-3s they need to protect their brain, also to protect their heart, and a whole host of other inflammatory-based conditions. For years, it's been difficult to tell if you have early onset dementia or, document the state of your brain as regards the degradation that causes dementia. And there's a new blood test out from, it's called the Proclivity AD2 blood test, which includes an algorithm that measures your level of the damaging tissues in the brain, things like amyloid plaque and neurofibular tangles. It's a little technical, but basically it measures these things in the blood and several things, and then measures the level of them compared to a standard. And this is a test, or a test that's been out for a while, and the results of its use was recently published at the Alzheimer's Association International Conference, data study presented by Oscar Hansen, MD, PhD from Skane University in Sweden, and it was also published in the Journal of the American Medical Association. So this blood test had a diagnostic accuracy of 91%, compared with 61% diagnostic accuracy after standard clinical evaluations by primary care physicians, and compared to 73% accuracy after evaluations by dementia specialists, usually neurologists. So this is a very exciting test. It is available now at Proclivity Labs by C2N Diagnostics. I just went on their website earlier today to find out pricing. I haven't heard back from them yet, but I hope to have pricing for this soon. It's probably not cheap, but like all tests like this, they become less expensive as time goes by. And just based on the fact that it has a diagnostic accuracy of 91%, compared with 61 to 73% with the standard methods that most physicians are using now. And the amount of money that could be saved by potentially treating this earlier, argues that it could probably become a standard test that's available through insurance eventually. But, things like this, it can take a few years for that to happen. So stay tuned. I'll let you know as soon as I know what the pricing is on that. Here's another really exciting test. Intermittent fasting may improve memory, executive function. So these are measures, obviously measures of things that have to do with dementia. So what is intermittent fasting? Intermittent fasting means usually trying to avoid eating more than a certain number of hours per day. So there are lots of different kinds of fasts where people don't eat all day, sometimes even for days at a time. This is not that. The intermittent means regularly not eating for 16 hours a day, for example, trying to get whatever meals you're going to have in an 8-hour period, sometimes a little bit longer. But for example, just eating breakfast and lunch. Unfortunately, it's more common for people to skip breakfast and only eat lunch and dinner. But the one meal that you need the least is the one that you eat right before you go to bed. So if you're eating dinner at 5 o'clock and lunch at 12, then that's not a bad way to do it. But if you're eating lunch at 12 or 1 and dinner at 8, that's not such a great way because you don't need food to sleep. So there's lots of information available on the internet about intermittent fasting. And this trial that's exciting because of the effects it has on improving memory and executive function. These are two markers for brain health. Was an 8-week randomized clinical trial, a small trial of 40 overweight, cognitively normal older adults with insulin resistance. And they basically did one of two things. Half of them were on a quote-unquote healthy living diet based on portion control and calorie restriction. So basically just on a low-calorie standard weight loss diet. The other half was on the same diet for 5 days a week and just 2 days a week. Only 2 days a week. They did 2 meal replacement shakes, 480 calories a day. And the rest of the 5 days, they did the same diet as the other group. And so just 2 days out of a week doing this calorie restricted meal, intermittent fasting, two meal replacement shakes per day had a significant difference in improved executive function and memory. And the intermittent fasting showed better results on cognitive measures. This test was done reported by Dimitrios Kapogiannis, MD of the National Institutes on Aging and Johns Hopkins University School of Medicine in Baltimore, and presented at the Alzheimer's Association International Conference. It was also published in Cell Metabolism. So it was a small study, and obviously, I would imagine lots of other studies have given us reason to believe that a more typical intermittent fasting program, where you're most days, not just 2 days a week, but most days, restricting the 2 meals a day that you eat, or a number of smaller meals, to an 8-hour window, and then not eating for 16 hours to let your body break down and digest and assimilate all of that food, has a huge impact on your health, including your brain. I'm Dr. Todd Binkley. You've been listening to Safe, Effective, Natural Solutions to Almost Any Health Challenge. Today we're talking about dementia, diabetes, and cardiovascular disease, and how these three are inextricably linked. You can't have one without the other. So, we're all familiar, hopefully, we're all familiar with the causes of diabetes: eating too much sugar, not exercising enough, obesity. And, the causes of cardiovascular disease are pretty familiar to most people: not enough exercise, not enough healthy food to keep your heart strong. Some of the lesser common causes of cardiovascular. Well, one of the things that most people hear about for cardiovascular disease is high cholesterol, right? Everyone needs to take a statin drug to keep their cholesterol down. Not true. I've talked about that over and over and over again. But these three things are linked, and there are some uncommon causes of heart disease and diabetes that you may not have heard of. So just recently, this came out in the medical literature, the effect of heavy metals predicting risk of heart disease. So cadmium, tungsten, uranium, cobalt, copper, and zinc. Increasing levels of these 6 metals on urine testing were associated with 29% more cardiovascular disease and 66% all-cause mortality after accounting for demographic, lifestyle, and other clinical risk factors. And cadmium and copper showed a direct relationship with both cardiovascular disease and mortality. This was reported by Irene Martinez Morata, MD, PhD of Columbia University and the Public Health School of Public Health in New York City, reported in the journal Circulation. So, quote, this is her quoting, "Our findings support the fact that urinary metals are a robust predictor of cardiovascular risk and all-cause mortality. And these associations with these clinical events, heart attacks, etc., are consistent with a previous finding that these same 6 metals were associated with higher levels of coronary artery calcification, supporting the idea that atherosclerosis, hardening of the arteries, is a major underlying pathway explaining the association between metals and heart disease." So let's just review that again. This is a major journal. Circulation is a very prestigious journal for cardiology, and they're finding that these heavy metals that we're all constantly exposed to increase cardiovascular disease, all causes of mortality, and specifically coronary artery calcification, the hardening of the arteries that underlies most heart attacks and can cause strokes. So these heavy metals, cadmium and uranium, are 2 really common toxic metals that have been known. The effects of these are well known, have been tested for years. Prior studies have established that arsenic, cadmium, and lead are contaminant metals, and exposure to them are now considered a cardiovascular risk factor by the American Heart Association. Functional practitioners like myself have long known that the big five heavy metals we're always looking for when we test for heavy metals are lead, mercury, arsenic, cadmium, and uranium. So we're all exposed to those to varying degrees, and most of us never test for those things and have no idea how much of those we're carrying in our bodies. The only way you know is to test. They don't necessarily cause any symptoms until they get really bad. So it's important. It's really a good idea for everybody to get tested for heavy metals. And the test for that is either a hair test or a urine test. And check out my past episodes. If I haven't already, I should remind everyone that all of the past episodes of this show are available as podcasts. You can listen to them anytime you want. You can find them on my website, BinkleyHealingCenter.com. They're right on the homepage, easy to find. If you use Apple Podcasts or Spotify, they're there. Just Google my name, Binkley, and they usually come up, or the title of the show, Safe, Effective, Natural Solutions. The past episodes are also on YouTube. If you search for my name or Safe, Effective, Natural Solutions, they're not always in order on YouTube, and there's no video. It's just they make a little video of a bouncing this or that, but you can listen to them there as well. So anyway, previously I've talked a lot about heavy metal toxicities, and this is a relatively new study that just came out talking about the connection between our exposure to toxic heavy metals like cadmium, uranium, and cardiovascular health. So they also mentioned cobalt, which is in vitamin B12, copper, and zinc. So these are essential minerals that we depend on for life, but like iron, you can get too much of them. And these are also urine tests without any kind of a provocation or a chelating agent to draw them out. And again, that's a little technical, but the authors of this study are saying in the study, they say, well, it's right here, the copper, zinc, and cobalt. Authors explained that these essential metals are tightly regulated in the body, and elevated levels in the urine may just represent early cardiometabolic dysregulation. So they may just represent a diseased state. Your body's the increased amount of these things being flushed out is a result of disease, not necessarily the cause. Whereas toxic heavy metals like cadmium, uranium, and arsenic are well known to cause these diseases. One of the most common sources of cadmium, which is a known carcinogen, is smoking. Smoking cigarette, tobacco is full of cadmium, but it's in ceramics and certain industrial chemicals. There's just, Google sources of cadmium. It's in a lot of things. It's impossible to avoid all of these things. We're exposed to them to greater or lesser degrees, cadmium also affects the kidneys and the liver and the lungs. So I was surprised to hear about tungsten. So tungsten is on the test. It's not something that's been in the research for a long time, but similar evidence of harm, according to this article, is some things that are commonly exposed. People in the U.S. are commonly exposed to all of these from drinking water, food, air pollution, and indoor dust. So heavy metals are an lesser known contributor to cardiovascular disease that is becoming, the significance of which is becoming better known and better documented. And anything that causes heart disease causes dementia. You know, there's several different types of dementia that have been identified by neurologists and pharmaceutical companies that are trying to come up with different drugs to attack these different various types. Maybe it's important to make it's apparently important to make those distinctions. Lewy, do you have Lewy body dementia or frontal lobe dementia or classical Alzheimer's or vascular dementia? For the purposes of healing yourself and providing nutrients to heal your brain, the solution is the same. Anything that helps prevent heart disease helps prevent brain disease. All forms of dementia are in part, if not mostly, vascular disease. Your brain loses, tissue is damaged, cells are lost, scar tissue builds up to replace that damaged tissue from inflammation and lack of nutrients because of vascular disease, the same vascular disease that causes heart attacks and strokes. The calcification that builds up and clogs the arteries and prevents adequate nutrition to the brain is mainly what causes the slow decay and loss of brain cells in the tissue that leads to dementia. So anything that causes heart disease will contribute to loss of brain cells and neurodegenerative diseases like Alzheimer's and Parkinson's and any other neurodegenerative disorder in the brain. Here's another unusual, so most people know the causes of diabetes, eating too much lousy food, especially sugar-laden foods, but artificial sweeteners are often used by some people as an alternative to sugar. Here's an article that just came out. Do artificial sweeteners really help people with diabetes? A recent review led by researchers in Mexico concluded that sucralose, which is Splenda, is the brand name, is associated with various adverse health effects. Despite being considered safe in previous studies, the recent research suggests possible links to systemic inflammation, metabolic diseases, meaning diabetes mainly, disruptions in the gut microbiome, liver damage, and toxic effects at the cellular level. Quote, it is crucial to highlight the persistence of sucralose, Splenda, in the body and its ability to cross the placenta and its presence in breast milk, raising concerns about prenatal and neonatal exposure. Well, this is really important because a lot of women get gestational diabetes. They get diabetes when they're pregnant, and they may be using sucralose and these other alternative sweeteners that are not healthy to reduce their sugar intake. So there's better ways to do that. We're going to run out of time here to get into all of those things, but there's a whole other article here that I'll come to. I thought I had it here, but I'll have to come back to that. But xylitol is a sugar alcohol that is in a lot of alternative sugar-free things. It's in toothpaste. The small amounts in toothpaste are not really a big deal, but I'll try and find that and talk about it on another episode. Xylitol, you don't want to consume lots of that either. So the takeaway is anything that causes heart disease, diabetes contributes to heart disease. Alzheimer's is often now being called type 3 diabetes because the high blood sugar that damages blood vessels to the brain also dramatically contributes to dementia. So send me your questions about this and any other subject that we've talked about or any other health concern that you have. I really appreciate you tuning in, and you can reduce your risk of heart disease, diabetes, and dementia by eating better food, getting a little bit better exercise. If it's hard for you to exercise, get the relief from pain that you need. Contact me about that as well. I am a non-force chiropractor, can help with pain as well. And I'd love to help you or someone you love get back to feeling the way they should. See if you can do something this week to be healthier than you were last week. Have a fantastic weekend.
You've been listening to Safe, Effective Natural Solutions with Dr. Todd Binkley. If you have a health question you want discussed on the show, email your health questions to Dr. Binkley at binkleyhealingcenter.com. Take advantage of this opportunity to ask questions for yourself and for your loved ones, because our health matters. Join him next Friday at 4 p.m. for safe, effective natural solutions, right here on 98.3 The Word, KDAR.